Also, whenever you're doing the adjustments, what goes very well with it is certain exercises that I recommend. These are certain stretches that coincide very well to help stabilize the spine. So some of the ones that I do is for the low back is making sure that you're doing the decompressive ones, the piriformis stretch, right? You're stretching out the psoas. The psoas has attachments to the front part of the lumbar, which is your low back. So many times when we're feeling that complete tension in the low back, we feel like it's just never letting go. The psoas in the front, right below the belly button, is one of the prime spots of the muscle bellies, and you just go right to the lateral, right? So that means just go midline, right below the belly button, and then move out more towards the side of your body. And if you dig in there, you'll feel that tight muscle. That's one key muscle when you have low back pain. Then when you release that, you start to feel a little bit more relief. All right. Another one that I recommend is in the neck. You want to make sure that you are increasing the tone and the strength of your posterior chain through these different stretches and exercises. One of them is the rotation movement here. You want to make sure that you're constantly moving and rotating that neck, because the way the biomechanics work of the body is that you're constantly increasing that tone, which is releasing and also causing relief in that neck too. Also taking it and laterally bending the neck there, taking it down, taking it up, moving the shoulders, getting those in the shrugging motion as well. It's very key stretches for you to be doing. I also recommend yoga. Is very key. More of a yin yoga where you're going into those deep stretches, focusing more on the breath. A lot of people don't breathe into their diaphragm. So taking some time to actually breathe into the diaphragm, learning how that actually feels when you fill your stomach up with air, and then breathing out. A lot of people are chest breathers. The sad thing with chest breathing is that it puts you in more of a sympathetic overload, where if you breathe into the diaphragm, you're activating more of your parasympathetics, which is where your rest and digest is, which is where the healing lies. When you're in a sympathetic overload, that's whenever you are more in a fight or flight, you're more anxious. If this sounds like you, there's a high chance that you have some type of subluxation, right? The Greek word sub means less than, lux means light, and that's Greek. If you have this less than light in this area, this less chi, right? Less energy or stagnant chi in that area, then you could be having some of these symptoms where your body feels like you're constantly having to fight or flight. You can't really digest your foods that well, you're constipated. There's a lot of things that we're seeing in our patients nowadays. It's because your body can't actually stop, rest, and digest, because it feels like you're always going, because you get out of the bed, you're late to work. Rushing to work, you grab coffee to get your adrenals going. Then you're running into the work late. Your boss is stressing you out. Kids calling, you gotta go get them from school. All that keeps you very sympathetic overload, which causes the body to not worry about healing. How can it heal when it has to fight for its life?